I'm giving my oral presentation to my husband and daughter. How does postnatal depression affect mother-baby attachment? What is postnatal depression? Postnatal depression is depression that occurs in a mother following the birth of a baby. It can be a brief period called postpartum depression, or it can last for many months or years, which is called chronic depression. 1 in 7 women experience depression during pregnancy or the first year after giving birth, and the number is growing. Why is it important to study postnatal depression? Depression is among the most prevalent medical disorders in today's society. Mothers suffering from depression are at high risk for developing weak bonds called low-quality attachment with their infants. Also, when an infant and mother do not have a strong and secure attachment, both suffer from the loss. Depressed mothers are often caught up in a vicious cycle, which is when they have the lack of attachment causes them feelings of greater inadequacy and helplessness that worsens their depression even more. John Bowlby was a very prominent psychiatrist and pioneer in the field of attachment. He said, "What is believed to be essential for mental health is that an infant should experience a warm, intimate, and continuous relationship with his mother in which both find satisfaction and enjoyment. When this does not occur, insecure attachment and attachment disorders are prevalent." Maternal depression is one of the recognized causes of insecure attachment and attachment disorders. As you can see from this list, a lot of the causes of attachment problems are things like abuse and emotional neglect, but also maternal depression is one of those causes. There are interesting relationships between when children have a secure attachment and the effects that they have as adults from that, as opposed to when they have insecure attachments as children. So if they have secure attachments, they're able to separate from their parent and seek comfort from their parents when they're frightened. When the parents return, they have positive emotions. They are comforted by the return of their parent, and they prefer their parent to strangers. This translates as adults to having good, trusting, lasting relationships, good self-esteem, and they are able to use their social support well as adults. Secure, high-quality attachments between mothers and infants are critical for the infant's mental and emotional development. Disordered or insecure attachments can lead to difficulties in self-awareness, self-evaluation, and self-management. How do depressed mothers behave differently than other mothers? Some of those issues that come up with depressed mothers are things that you would commonly be aware of, things that would make it hard for them to engage positively with their infants, like not playing or reading or singing to their child as much, having trouble managing basic well-being tasks like taking their child to the doctor or child-proofing their home. When mothers are depressed, they have inconsistency in their life. Their symptoms will tend to wax and wane, so they have less consistent discipline, and their overall parenting quality will often suffer from that. They have a less stable environment in general that they can offer for the infant. Maternal depression leads to deficits in the quality of maternal parenting behavior, which in turn contributes to attachment problems. Now we see some of the converse of the cause and effect of attachment. This is from children who had insecure attachments, that they were wary of strangers, and they're distressed when their parent leaves, but they're also not comforted by the parent when the parent returns. And then that translates as adults to reluctance to be close to others and worrying that their partner does not love them or becoming distraught when a relationship ends. So you can see how the insecure or ambivalent attachments cause more issues later. This quote from Myrna Weissman is interesting in how it relates the attachment problems. It says, if you have a depressed mother, you ought to do everything you can to get her better because there's a double effect. While depression may be a genetic disorder, it has a strong environmental component. And for a child, a parent's illness is a very strong environmental effect. You want to reduce that effect so that you can have a beneficial effect on the child. She also said depressed parents should be treated vigorously. The impact is not only on them, but it's also on their children. Consistent screening is one of the most important steps to identifying and treating postnatal depression. And this is often done in a hospital setting or on routine visits. It could be pediatric visits or postpartum follow-up visits as well. A lack of self-awareness is inherent in many cases of depression, making treatment difficult. So this is just a funny comment here that says, not sure if I'm doing nothing because I'm depressed or if I'm depressed because I'm doing nothing. So a lot of times people who are depressed are having a hard time sorting out their feelings and not even really recognizing that they have depression or that they should seek help. Sometimes they're thinking that the feelings will just go away, they're not sure what to do. So that's one of the difficulties in treatment. The challenges in providing treatment for postnatal depression, many of those are that programs that follow mothers and infants after birth are often for only 6 months or less after the birth, and they're just focusing on postpartum depression and not following the mothers very long. Research indicates that less than 20% of women diagnosed with postnatal depression had reported their symptoms to clinicians. So often, as we noted in the last slide, they have a hard time self-reporting their postnatal depression because they're not aware that they have it or they're not aware of the risks involved. Societal stigma of depression in general works against providing treatment because a lot of times people don't want to be labeled as having depression, and they are either afraid or ignorant as to what will happen if they get diagnosed. Intervention should be ongoing. It's important that mothers with depression need greater support as their infant progresses to different stages because they struggle to adapt to the changing demands that accompany their child's growth and development. So as the child gets older, they have an even harder time making those transitions to different stages with the child. This is an interesting statistic about postnatal depression that helps us understand also that there's a lot of progress that we need to make in society with that. It says 39% did not seek or weren't given treatment or support for postnatal depression. So we see that there's a lot more awareness that needs to happen, and people need to do a better job of treating it. So what can society do to help? Increase awareness of the effects of postnatal depression. If people understand that it is a big problem that can have a lot of effects on their infants, then they're more likely to seek help. Provide support for women beyond just that initial postpartum period. We discussed that as well. Conduct more research to determine which treatments and interventions are most effective at reducing the negative outcomes in infants of depressed mothers. So as more research is done, we'll have a better realization of what to focus on. That will help a lot. This is a type of handout or flyer that could be used in treatment areas or in places that mothers tend to be to help increase awareness. It just shows that the prevalence is high for postnatal depression and how to get help, and that's the kind of thing that can increase awareness in the community and society. And then to the moms struggling with postpartum depression, you are not alone. These are the kinds of things also that can just be supportive for mothers, that they'll understand that it is common and it's something that they do need to get help for. In conclusion, many adverse effects on the development of infants can be linked to maternal postnatal depression. Insecure and low-quality attachments between mothers and infants can lead to poor development outcomes. And every effort should be made to identify and treat postnatal depression to mitigate these negative effects.